A 1-week course of antibiotics can remove up to 1/3 of your gut bacteria. And that damage cannot be undone by simply taking a probiotic. So you need to be absolutely certain that you really need that antibiotic. I'm going to tell you how to do that. I'm Dr. Robynne Chutkan, gastroenterologist, microbiome expert, and author, and I am here to help you find gut bliss. On today's episode, I'm going to share some critical questions to ask your healthcare provider if you have been prescribed an antibiotic. The medical community is just now finally beginning to embrace this idea of the importance of the microbiome and the really sort of critical role it plays in keeping us healthy. But not all practitioners are equally knowledgeable about the risks of antibiotics. Long-term antibiotic use has been linked to higher rates of heart disease and stroke and aging of the brain. Antibiotics can increase the risk of lots of different chronic diseases, including allergies, autoimmune diseases, metabolic conditions like obesity and diabetes. They are associated with an increased risk of psychiatric disease and even colon cancer. Frequent antibiotic use in childhood has been linked to the development of serious autoimmune diseases like juvenile rheumatoid arthritis and Crohn's disease. And because of the negative impact on the developing brain, it can affect cognitive and emotional function in children and increase the risk of anxiety and depression. If you want to learn more about the role of the microbiome and how antibiotics can really disrupt that, and also what to do about it, highly recommend my second book, The Microbiome Solution. But let me give you just one statistic that I think puts it in perspective. A 5 to 7 day course of a broad spectrum antibiotic, like the kind you might be prescribed for a sinus infection or a urinary tract infection, that can remove up to 1/3 of your gut bacteria. And be clear that those bacteria cannot be replaced by simply taking a probiotic. That is not how it works. Now, there are some situations where an antibiotic is definitely required, but you would be surprised at how often the need for antibiotics is really a gray zone. A study published in the journal Pediatrics found that pediatricians prescribe antibiotics 62% of the time when they think that parents expect them to be prescribed, and only 7% of the time when they thought the parents didn't. That is a big difference, 62% versus 7%. So that tells us that an absolute need for antibiotics is actually not that common, and more often than not, the antibiotic is optional. And it's not just children who are being overtreated. 2 out of every 3 adults who see a healthcare practitioner for cold or flu symptoms are prescribed antibiotics, 2/3. But 80% of the time, that prescription does not meet the CDC, the Centers for Disease Control and Prevention, does not meet their guidelines for antibiotic therapy. So knowing that doctors are more likely to prescribe an antibiotic when they think that you're interested in taking one, when they think you're sort of expecting and wanting one, and knowing that there is generally a lot of leeway in whether the antibiotic treatment is really needed, how do you use that information to avoid antibiotics when that is a reasonable option? And by reasonable option, I mean when not taking an antibiotic is not going to lead to a bad health outcome, and in fact, it may lead to a better health outcome. When we come back, the first and most important question you absolutely must ask your healthcare provider if you have been prescribed an antibiotic, when we come back. The Gut Bliss podcast is brought to you by VisBiome, my first and quite frankly, my only choice for a probiotic. Whether you're dealing with irritable bowel syndrome or just looking to restore your gut health, VisBiome can help. It's a medical food for the dietary management of IBS and gut inflammation. Backed by science and clinically vetted by thousands of my own patients. Find your gut bliss with VisBiome. Go to visbiome.com/gutbliss and use discount code GUTBLISS at checkout. Before we dive into the 10 questions, I want to be very clear about something because I love sharing actionable gut health information on this podcast. That's really the goal of the podcast. But I want to remind you that I am not in a position to give you medical advice simply because you are not under my care. And I always want you to have the best care possible. And that means an actual relationship with somebody who knows you and is involved in your medical care. The other thing I want to point out is that I am not suggesting that you don't take an antibiotic or delay seeking advice from a healthcare professional when you're sick. But I am suggesting that you analyze and you query medical advice, especially advice around taking any medication, really, but we're talking about antibiotics today. And I'm also suggesting that you engage your healthcare provider in a dialogue, a respectful dialogue, that may include some pointed questions. So let's talk about the first question on the list because it is the most important. And, after you ask this one, it may not be necessary to go through all 10, but the list can help frame your conversation. So starting with the first and most important question, it's a simple one. Question number 1, is this antibiotic that you are prescribing for me absolutely necessary? That's it. That's question number 1, the most important. And again, you would be surprised. Remember that pediatric study, 62% of the time they prescribe an antibiotic when they think the parent wants one, 7% when they think the parent does not. So you would be surprised how often with that first question, the doctor or the nurse practitioner, whoever's doing the prescribing says, actually, no, it's not really necessary. It's, we're just using it preventatively. So let's go on to question number 2. Question number 2 is this antibiotic that you are prescribing for me being used to treat an actual infection that I have, or is it being used to prevent an infection that I may get? So really what that question is asking, is this for actual treatment or is this for prophylaxis, for prevention of an infection that may or may not ever develop? That's question number 2. Because again, things like the dentist's office, when you go to have certain types of dental work, they'll often give you an antibiotic. And what you have to realize is that the risk of that antibiotic, of things like Clostridium difficile happening, it can be quite severe diarrheal illness. People can end up losing their colons with Clostridium difficile. People can end up dying from Clostridium difficile. The risk of something like that happening is often greater than the risk of whatever infection they are trying to prevent. So that's why that question is so important. You're trying to distinguish between treating something that is present versus a preventive type treatment for something that may or may not happen. Okay, question number 3. Do you have the results of the culture, the swab, or biopsy back that demonstrate an infection? Or are you treating me presumptively because you think the results will be positive? And where this comes into play, for example, is you have some burning when you urinate. You think you have a urinary tract infection, and you go to the doctor and they do that little urine dip. Now, to be clear, that urine dip is checking for white blood cells and it's checking for bacteria, but it is not diagnostic of a urinary tract infection. To find out if you actually have a urinary tract infection, you have to have a urine culture. And guess what? That takes days to come back. 48 hours, 72 hours. So, 3 to 5 days, depending on what's growing, how fast the lab is. But you cannot diagnose an actual urinary infection with a urine dip. So again, if you have some burning when you urinate and you go in and they do the dip and they say, oh, here's antibiotics, you have a urinary tract infection, this is when question 3 comes in. Do you have the results of the culture to demonstrate an infection? Are you treating me presumptively because you think the results will be positive? So one way to get around that is to take the antibiotics and ask the office to call you. Say, can you call me when the culture results come back? Because frequently the urine dip is positive, meaning, yes, they're seeing white blood cells, but the culture comes back with the amount of growth of bacteria that is under the threshold amount. There's a specific cutoff because guess what? Urine is not sterile. There is often bacteria in it. But it's only when the bacteria reach a certain amount that we say that's a urinary tract infection. And again, there are other things to keep in mind. How severe are your symptoms? How old you are? Do you have other illnesses that put you more at risk? It's not a sort of absolute yes or no. So while there is a threshold, if you are an older person with other problems, say you have bladder cancer, the threshold may be lower to treat you. It may be that, well, you don't quite meet the criteria for a urinary tract infection, but it's close and you're very symptomatic and you have a fever. And so we're going to treat you. On the other hand, if you are a young, healthy person, and by the time the culture comes back, you may not have any symptoms at all. They may say, you know what, you're doing fine and you're not quite at the threshold. We're not going to treat you. So this is a very personalized thing. And this is why it's so important to be getting care from somebody who knows you, where you can have a dialogue, not just a sort of yes or no. Question number 4. What other options are there for me to feel better besides an antibiotic? And so this is really important. For example, if you have a respiratory tract infection, which is often viral, but you feel terrible and you want somebody to give you something to make you feel better, and you often think that's an antibiotic. And your healthcare provider wants you to walk out of the office feeling like you have a solution, even if that solution is not really treating the problem that you have. And so for a lot of practitioners, they think, well, it's probably viral or self-limited, but the antibiotic can't hurt. And unfortunately, that's a first mistake, because the antibiotics for all of us, even if we have a relatively healthy microbiome, it's a cumulative effect. So you want to limit the amount of antibiotics that you are exposing your gut microbes to. So this question, what other options are there for me to feel better? For example, if you have a respiratory tract infection, it may be that, hair is something to soothe your throat, or hair is something to bring down the fever a little bit, or to help with a headache, or, the coughing is tricky because we don't really recommend these cough medicines anymore, because actually when you cough, you are coughing up the mucus with a pathogen, and you're sort of expelling the pathogen from your body. So we don't want to suppress that. We'll talk about that in another episode. But it may be something for symptomatic relief. If you have urinary symptoms, there are bladder antispasmodics. There are things to soothe the bladder. If you are in a situation where you don't quite meet the criteria for an actual full-blown urinary tract infection, but you're having some symptoms. So what other options are there for me is a really important one. And question number 5, what would be the natural course of my illness if I did not take an antibiotic? And again, here you would be shocked that often the doctor's like, well, you'll be sick for an extra day or 2, but it's going to be the same thing. You're eventually going to get better. So you're going to be sick for 3 days with the antibiotic versus 4 days without. Okay, I'll take an extra day of illness if it's just a cold or something. And again, a lot of this has to do with how many antibiotics you've taken in your lifetime. So for example, for my daughter, which is really, her journey was really what sort of changed the course of my medical practice, because she was a C-section baby. She was given antibiotics at birth, large doses of IV antibiotics in the neonatal ICU just in case, because I had had a fever, because I had had the flu during my pregnancy. And then that really set her up for this journey of frequent antibiotics. So by the time she was 2, she had had literally over 20 courses of antibiotics and was sick all the time. So for somebody like her in childhood, once I put 2 and 2 together and figured out that part of why she was sick all the time was because of all these massive doses of antibiotics she had had starting at birth, once I figured that out, I had a very different threshold. When I would go to the pediatrician, I would say, okay, so she has an ear infection. Do we know this is bacterial? Could we watch and wait? So because she had had such damage to her microbiome, not just from the antibiotics, but also from a C-section delivery, from only being nursed for 6 weeks, I had to have a much higher threshold for trying to figure out with the pediatrician whether an antibiotic was really necessary. If you have an 18-year-old with strep who was born vaginally and nursed and has been eating a healthy diet and has never taken antibiotics, and they have a whopping terrible case of strep and they're suffering, you might say, you know what? Yeah, bring on the antibiotics. Somebody else who has a child, again, maybe more with a history like my child has, may say, well, what would happen if we didn't treat the strep with antibiotics? Would it go away on its own? And if you're interested in that, please check out episode number 6 of the Gutless podcast, To Treat or Not to Treat, Does Infection Always Equal Antibiotics? I dive deep into that with a whole sort of case history of a mother who called me about her child with strep. So question number 5, what would be the natural course of my illness if I did not take an antibiotic? Because believe it or not, even many bacterial illnesses are self-limited. They don't necessarily need to be treated. There are GI infections, for example, where treating with an antibiotic can actually prolong the carrier state, meaning it can increase the amount of time where you are infectious with the organism. And for some of those GI illnesses, there's a very clear cutoff. If you have fever, if you have evidence of this in your blood, if you're, quite sick, we treat with an antibiotic. But if you don't, for some of these GI illnesses, if you are just having diarrhea and feeling crummy, there are circumstances where an antibiotic will actually make you worse because it'll continue the illness and continue the amount of time for which you're infectious. So even for bacterial illnesses, do not always require an antibiotic. Okay, that's a lot of information. So we've gone through the top half of the list, the first 5 questions. When we come back, the second half of the list, what are the other 5 questions that you should be asking your healthcare provider if you have been prescribed an antibiotic? We are back with the second half of the list. And question number 6, how long should it take for me to start feeling better if I don't take an antibiotic? And what that question is really asking is, what is that threshold amount of time I should wait before I start this antibiotic you've given me? So it's perfectly reasonable to take the prescription from the healthcare provider and let them know, don't take it and tell them you're going to take it if you're not going to take it. So if you take it and you say, I'm going to have this poised and at the ready, by my bedside in the medicine cabinet, and I want to know, I'm going to, try and not take this because I don't feel that ill, and you're telling me it's not 100% necessary. But how much time should I give it before I go ahead and take it? Should I wait a day, 2 days, 3 days, 4 days, a week? What is a time frame for me to decide, okay, this isn't getting better on its own, I need to go ahead and take that antibiotic? So that's question number 6. Question number 7, if I do take this antibiotic, what is the shortest amount of time I can take it for? And really what you're asking there is, what is a minimum course of antibiotics? And I'll tell you, this has really changed in the medical literature. We used to say often a 10-day course and don't take it any less because you'll develop resistant bacteria. Now that has really changed, and the focus is on the minimum amount of time. So we've seen conditions where in the past we would recommend 10 days, now recommending 5 days, sometimes even 3 days. So that is an important question because, again, this is cumulative damage. So 7 days of antibiotics is better than 10 days, and 5 days is better than 7, and 3 days is better than 5. So the minimum amount of antibiotics is the goal. Question number 8. Is there a more narrow spectrum antibiotic, such as penicillin, that would still be effective for my condition? And the important thing there is that over time, over the last few decades, we have developed more powerful antibiotics that kill more things and kill sort of more aggressively. And unfortunately, that means that they kill the pathogens more effectively and more of them, but they also kill your normal, helpful, essential bacteria more effectively and kill more of them. And the reason that we often prescribe these broad spectrum antibiotics is because there's so much resistance, because we have overused antibiotics so much. And so we can't use a directed antibiotic because we don't know if the organism is going to be resistant to it, or we don't know if it's going to be a different organism. But the damage to your microbiome from a more narrow spectrum antibiotic, more targeted, like penicillin, the original, the OG, the damage to your microbiome is going to be significantly less. And there are conditions where we know ahead of time that we can use a more narrow spectrum antibiotic because we have data historically. And a lot of this data is geographic. So what we might use in the DMV area, DC, Maryland, Virginia, may be different from what we use in the West Coast based on the types of infections we see, data we have around drug resistance, et cetera. So it's important to be thinking, and of course your healthcare provider would ideally have access to this data and know that, yes, this is an organism that's usually causing this problem. And in this area, it is usually not resistant to this antibiotic, but you can save a lot of your microbiome if you use a more narrow spectrum antibiotic. Question number 9. If I decide not to take this antibiotic, what are the signs to watch for that might suggest that my condition is worsening and I should start the antibiotic? And this is really related to question number 6, right? How long should it take for me to start feeling better if I don't take an antibiotic? So question number 9 is sort of the sister question, if you will, to that. What are the signs to watch for that might suggest that, you need to start taking that antibiotic? So for example, if you have dental work, they may say, well, if your gums get really sensitive or you have a fever or you have pain when you're chewing on that side, all kinds of different things. But ask about those symptoms and ask for specifics. Question number 10. And kind of like question number 1, where I said this is the most important one to ask, to just simply ask it, to say, is this antibiotic absolutely necessary? Question number 10 is, what is the worst thing that could happen if I don't take this antibiotic? If the worst thing that could happen is, well, you could die, I might reconsider the antibiotic. But if the worst thing that can happen is, well, you're going to be sick for 48 hours longer, and you're not even that sick to begin with, that's very different. So you need to know that. And you'll see some of these questions are, you don't need to sit your doctor down and, okay, I'm going to go through 1 through 10. I need an answer for all of them. Because again, if you've already gotten the information you need and they've pretty much told you that, yeah, this is a self-limited illness, you'll only be sick for a day or 2 longer, not a big deal, then you don't really have to ask question number 10 typically. But I wanted to make sure that I provide you with a compendium, if you will. I love that word, compendium. A compendium of questions so that you can mix and match and you can figure which one flows from which other one so that you really have a full toolbox of questions to ask. I want to leave you with 3 takeaways about what to ask if you've been prescribed an antibiotic. Number 1, antibiotics are overprescribed. That's a fact. And just because one has been recommended to you by a healthcare professional does not mean that you actually need it. Number 2, asking whether the antibiotic you've been prescribed is actually necessary is the first and most important question. And again, I've given you plenty of follow-up questions to ask after that one. And number 3, remember that the damage done to your microbiome by antibiotics cannot be undone by simply taking a probiotic or eating some yogurt. So you need to make sure that that antibiotic is absolutely necessary and that the benefits outweigh the risks to your health. So that's it for this week's episode of the Gut Bliss podcast on 10 questions to ask your healthcare practitioner if you have been prescribed an antibiotic. Coming up next week, 10 things to do to restore your gut health after taking antibiotics. You've asked all the questions and you have been told definitively that an antibiotic is necessary. Now what? How can you restore your gut health after that course of antibiotics? Join me next week. Go to gutbliss.com for my free 7-day microbiome reboot course. If you like what you're hearing, drop a review and hit that subscribe button. And remember, dirt, sweat, vegetables, the best prescription for a healthy gut.
The information presented in this show is not meant to be medical advice. Consult your doctor before making any decisions about your health. The patients discussed are real people, but names and identifying features have been changed to protect their privacy.